Welcome back to 14 Remedies for Diabetes. Cinnamon. A research conducted on people with type 2 diabetes established that 1 to 6 grams of cinnamon per day can not only lower serum glucose but also triglyceride, LDL, cholesterol, and total cholesterol. Diabetics are naturally prone to cardiovascular diseases, and thus taking cinnamon daily makes sense as this reduces the risk of getting cardiovascular diseases. Cinnamon powder lowers blood sugar by stimulating insulin activity. It is also beneficial for people who have been diagnosed with prediabetes status, meaning those who have high fasting sugar levels in their blood. Having cinnamon will prevent them from getting diabetes. However, the type of cinnamon matters when you use it for therapeutic purpose. The most commonly available cassia cinnamon contains a compound called coumarin, which is toxic and can cause liver damage. A rather expensive variety called Ceylon cinnamon is safer to have when considering cinnamon powder as a remedy for your diabetes. As it is, only half to 1 teaspoon of cinnamon Pt.2 is efficient. Take 1 liter of water and boil it. Once it starts boiling, switch to simmering and simmer for about 20 minutes. Add 3 teaspoons of cinnamon powder while you simmer the water. After 20 minutes, strain the liquid and have this water daily. Or you could add 1 teaspoon of cinnamon powder and 1 cup of warm water and drink this daily. You may also sprinkle cinnamon powder in your salads, dips, and other dishes. Or you could add cinnamon powder to your milk, coffee, or tea. Jamun. Rich in vitamin C, calcium, phosphorus, and iron, Jamun, or the black plum, and not the blackberry, which is a different fruit, has been traditionally used by Unani, Ayurvedic, and other Asian medicine systems for controlling diabetes. Jamun seeds are extensively used to cure diabetes. However, extracts of the bark and leaves are beneficial for lowering blood sugar and glucoria or sugar in urine. The main ingredient with anti-diabetic function in Jamun seeds is jamboline chemical. This chemical alone could not act as an anti-diabetic cure. It is only effective when other inorganic or inactive substance in the Jamun seed. Jamun seeds are rich in alkaloids that have a hypoglycemic effect. Many studies have shown that jambu or jamun has such hypoglycemic effects that can reduce up to 30% of blood sugar. You could have up to 1 to 1.5 teaspoons of jamun powder and mix it with water every morning on an empty stomach. Jamun is a seasonal fruit. When available, have them raw daily. And you can also chew on the jamun leaves. Curry leaves. A study published in Chemical Biological Interactions states that due to its rich mineral reserves, like those of iron, zinc, and copper, curry leaves are important in maintaining normal glucose levels in the blood. These minerals activate beta cells of the pancreas that are responsible for the production of insulin hormone. Curry leaves also influence metabolism of carbohydrates favorably. They can restore liver and kidney enzymes responsible for breaking down carbohydrates back to their normal levels, thus treating diabetes. As diabetic patients have decreased levels of antioxidants, their body cells may die at a faster rate. A study found out that curry leaves can reduce cell death in pancreatic cells, which are responsible for insulin production. Curry leaves can reduce blood sugar levels and are especially helpful for people who get diabetes due to obesity. If diabetes runs in your family, you should consider having curry leaves, as it is known to prevent hereditary diabetes too. You can chew 8 to 10 fresh curry leaves in the morning, or you can use curry leaves in your daily cooking, add them to salads and dips, and even in gravies, sauces, and curries. Aloe Vera. While aloe vera is traditionally used as a medicine for diabetes, some modern researchers have found it beneficial for lowering blood glucose and blood lipid levels in diabetic patients and heart patients. The hypoglycemic activity of aloe vera has proved to be useful in both insulin-dependent diabetes mellitus and non-insulin-dependent diabetes mellitus rats. It particularly helps in lowering fasting blood sugar levels. Combined with bay leaves and turmeric, aloe vera can be had daily. You can make an aloe vera herbal mixture for diabetes. Just get 1 teaspoon of aloe vera gel, 1 teaspoon bay leaves powder, and 1 teaspoon turmeric powder. Add the bay leaves powder and the turmeric powder to aloe vera gel and mix well. Have this mixture daily before lunch and dinner. You can also mix 1 to 2 teaspoons of aloe vera juice with a glass of buttermilk and have it daily. Mango leaves. While mango fruit is not meant for diabetics, mango leaves are. The Nigerian folk medicine make extensive use of mango leaves for treating diabetes. The aqueous extract of mango leaves has hypoglycemic activity. It reduces the intestinal absorption of glucose, thus helping in lowering sugar levels in the blood. These leaves can also help improve blood lipid profiles. However, mango leaves need to be consumed 60 minutes before having food to get its benefits. You can soak 10 to 15 mango leaves in a glass of water overnight. Filter this water in the morning and have it on an empty stomach, and have your breakfast in 1 hour. Or you could dry the leaves of a mango tree in shade. When they are completely dried, grind them to get powder. Store it in a container and have 1/2 teaspoon of this mango leaves powder daily before lunch and dinner. If you'd like to keep continuing on this information, please go to the next video for the conclusion of this series.